Hi, Anand. Are you there?
Hi, Meera. Yes.
Okay. Just as a reminder, we're going to go live in a short while. So you put your video on when I mention your name.
Okay. Okay.
Okay.
Good.
All right.
Thank you.
No worries.
She's saying we're about to go live. When she mentions my name,
it's on, it's lit.
Is it?
So I will go.
Okay. Your phone is on silent, so.
Yeah, silent. So the link is up.
Oh, well
So
done.
every touch on it, it goes to the YouTube.
Oh, well done. That's clever. Hopefully they're doing that now. If you're able to do that, they should be doing that, right?
Exactly. You can actually do the same thing.
Later, you just show me what we see now, what you as the viewer. They should be able to do it, right? Probably you can advise them better. I better. There's a chat box there, but
Sorry about that. We're having some serious technical issues today. Welcome to the 5th installment of the BFM's Health and Living webinar series. Today's topic is about what COVID-19 has taught us about smoking. We're having issues, as you can tell, with our Facebook page, and so you will have to join us via YouTube. The link is in the comment section. So do send us your questions instead via WhatsApp. It's 011-2571 2689. That number again, 011-2571-2689. Now, today's topic and discussion has been brought and made possible by our presenting sponsor, AIA Berhad. So joining me to have this discussion is the ever so handsome and, consultant cardiothoracic surgeon and president of the Lung Cancer Network Malaysia, Dr. Anand Sachithanandan. Welcome, Anand. How are you today?
Good afternoon, Meera.
Technical issues and all that. You look great. Thank you for joining us. As always, we have a lucky draw for you this week. You can download our exclusive guide on how to quit smoking from the link in the comments below, and you'll stand a chance to win a MedClean Auto Plus worth 439 ringgit, courtesy of AIA Vitality. And if you join the lucky draw every week, if you have been all this time, you'll also stand a chance to win one grand lucky draw prize at the end of the series, which is a Fitbit 4 special edition granite worth 838 ringgit, courtesy of AIA Vitality. I'll be announcing last week's winner at the end of this webinar, so stay tuned all the way to the end. So our topic today is going to encompass three main issues. One is, does smoking and vaping expose you to further danger when it comes to COVID-19? Or in fact, there's some research out there that's floating around social media that says nicotine exposure could in fact protect you from COVID-19. And also, where does lung cancer stand in the mix of all of this? So Dr. Anand here to answer your questions. Once again, that number, 011-2571-2689. So Dr. Anand, the WHO has just stated recently that smokers are more likely to develop severe disease with COVID-19 compared to a non-smoker. Do we know why?
Yes, Meera. What you said in your intro is absolutely right. There's a conflicting evidence and news out there in terms of whether smoking is harmful, as we would assume, for COVID-19. But paradoxically, there's also some suggestion that it might be protective against COVID-19. And if I can just give a very brief sort of background to why this is the case. I'm sure some of your listeners and viewers may have seen some of those very sensational headlines and almost alarming articles that suggest that smoking can be protective.
Yeah.
And this is a very curious observation that we have seen at the start of the pandemic. There was some data that came out of China, and similarly also from the US, and most recently a small study from Paris in France. And what they observed, very peculiar, they observed that amongst people who were hospitalized with COVID-19, the proportion who were smokers was remarkably low. It ranged between 1 to 6.5%. And this was considerably lower in comparison to the national smoking prevalence in those countries. So in the US, I think the national smoking prevalence is about 14%, taking the population as a whole. In China and France, Meera, it's about 25, 26%, similar to here in Malaysia. So this finding of a much lower incidence of smokers among hospitalized COVID-19 patients in comparison to the national smoking prevalence prompted the hypothesis, could somehow paradoxically, could smoking be protective against COVID-19? But I can share with everyone here that that is extremely unlikely. There are numerous reasons as to why this is not the case. I mean, the first thing we need to appreciate is the data that I've just mentioned in passing are fairly small studies. And, a lot of this data, we have good reason to doubt the veracity, the accuracy of this smoking data, because a lot of this was collected amidst an evolving, overwhelming epidemic or pandemic. Okay. So quite often, sorry, Meera.
No, I was just going to say you dashed the hopes of many smokers who hoped and maybe even hoped there was a tiny bit of evidence to show that nicotine could in fact protect them from something, But are you, although there's small studies, do you think that more studies should be done should be carried out towards looking at nicotine exposure and COVID-19? We probably don't know as much yet, but what are your thoughts on that?
No, I think absolutely. I think in medicine and in science, we have to keep an open mind and try to avoid bias. But just in terms of the findings so far, which, as you say, if you're a active or an avid smoker, you would hold out hope. But we have to be very judicious when we look at this sort of evidence. And I think there's a lot of built-in bias here. For example, smoking prevalence is highest amongst the lower socioeconomic class. And that strata of society, unfortunately, often has less affordable access to hospital care. Similarly, smoking prevalence generally declines in the elderly, and it's that cohort where there's often the ones most likely to be hospitalized.
Yeah.
So you can see how through selection, you could have a lower proportion of smokers amongst those who are hospitalized with COVID-19. And as I was saying, amidst an epidemic, doctors, healthcare workers, they may have been overwhelmed. They're not in a position to get a very detailed medical history. Similarly, the patients who are coming in may have been too unwell or too fearful to give a very coherent or a honest report of their tobacco use. So I actually feel that a lot of that lower incidence that was recorded is probably a under-reporting rather than a true representation. And in fact, Meera, as you mentioned there is now strong evidence from numerous studies that have been published that if you are a smoker or for patients who are hospitalized with COVID-19, smokers do worse. They are more likely to have a more adverse disease or more serious symptoms, which is likely to require, for example, admission into the intensive care unit, or they may require mechanical ventilation or an adverse outcome, including death itself. Data from China and from several other centers shows unequivocally that if you smoke, that risk is elevated. And it's not surprising, but that's quite clear.
Could you explain to us, smokers already have issues with the lungs, as in your lungs are affected already, right, with the chemicals and the exposure. So when you get COVID-19, what is it actually doing to the lung that sort of increases your risk of death, for an example? Research from the US is showing that hospitalized smokers with coronavirus were 1.8 times more likely to die, right? But so what is it that knocks you out compared to a non-smoker?
Sure. So you're right, Meera. I think most of the data would suggest that if you're a current active smoker, maybe 1.8, closer to twice as likely to have an adverse outcome, including death. And to sort of better understand that, we need to, well, first of all, I think we all appreciate that smoking is harmful for your lung health in general. So if you're a chronic or active smoker, your lung capacity, physiology, and pulmonary reserve is probably diminished. You may have, underlying lung or heart diseases. So those comorbidities will be an added strain to get through an illness like COVID-19. But if we look a bit more specifically, we know that the coronavirus, this novel coronavirus, the SARS-CoV-2 coronavirus, which causes COVID-19, we know it's predominantly a respiratory virus that targets the respiratory system. In other words, our lungs and airways. Now, it's not exclusively in the lungs and airways, but that seems to be the main target area. And what is not in doubt is we know the entry point. So the coronavirus, like all viruses, they require, a living host. In this case, us, humans. We need a living host for the virus to be able to infiltrate and replicate and then cause harm. And the critical entry point for the coronavirus into the host cell, into our human cell, is through the ACE2 receptor. So ACE2 is angiotensin converting enzyme 2. This is an enzyme or part of a hormone system that regulates our blood pressure, regulates our salt and fluid balance in the body. And the ACE2 receptors are found throughout various tissues in the body, including our kidneys, the lining of the blood vessel, what we refer to as the endothelium, in our gut, intestine. And importantly, it's also located in our airways, the lining of the airways, what we refer to as the bronchial epithelium. And within the lung tissue itself, in certain cell types, we call these the type 2 alveolar pneumocytes. So here's where it gets interesting. There's sufficient evidence now, numerous studies that have been published this year, which show that the level of these ACE2 receptors, which are the critical entry point for the coronavirus, these levels are elevated in smokers. They're higher in current active smokers compared to a former smoker or a non-smoker. So, therefore, I think if you are smoking, there is a upregulation and increased expression of these receptors. And therefore, if we look at it in very simple terms, it probably provides more opportunity for the coronavirus to bind to and infiltrate. So I would assume that could result in a higher viral load, which would probably translate to a more severe illness. So that is certainly one of the mechanisms that is as to how or why smokers are probably more susceptible to a more severe COVID illness and to worse outcomes.
We have a question via YouTube. How should I advise my dad to quit smoking as he's not firm on his quit smoking plan. I mean, this is a very interesting thing because, it's interesting that I was reading that about 1 million people in the UK have quit smoking during this pandemic. 41% have quit because of COVID. I don't know, maybe you could try the COVID scare. I don't know, Dr. Anand, what do you think?
Yeah, I reckon we should try the
It's
COVID
a great
scare.
time. It's a great time.
It is. I mean, I think it's difficult, isn't it? This is the perennial question: how to quit smoking effectively. There isn't a one-size-fits-all. It's I think the single most important thing is you must have the desire, the willpower to want to quit smoking. And I think, if we look at even in Malaysia, the smoking prevalence is still very high despite, the government's efforts. And certainly with COVID-19, Meera, with the MCO, it works both ways. It's a wonderful opportunity to do things differently. You may be away from work or societal, peer pressure to quit smoking. But at the same time, it's obviously a period of high anxiety and stress. All our lives have been upended. So if smoking is what we've been doing, it may be also a very challenging time to keep the habit. But COVID scare is definitely one strategy.
Yeah, but you're right. It's a double-edged sword as well because stress and anxiety, some people tend to smoke a lot more, right? What about, you mentioned something about current smokers and former smokers and non-smokers. Would you say former smokers and non-smokers are on the same level when it comes to being at lower risk when it comes to COVID-19?
I mean, to be honest, we don't have sufficient data. It's still a fairly new disease or illness. It's just this whole pandemic, it's been around since, I suppose, the end of December of last year when it first started in Wuhan in China. And the emerging evidence just suggests that if you are a current or active smoker, that risk is elevated, the risk of more severe illness, and as compared to a non or never smoker. And I think if you're a former smoker, you're probably somewhere in the middle. Yeah.
Okay. All right. Okay. So, right. Still okay. Still not doing too badly. Are vapors, there's a question via WhatsApp, are vapors safer than cigarette smokers when it comes to the risk of COVID-19?
I mean, the short answer here is probably no. And perhaps they might be an even higher risk group. So,
why?
I mean, it's interesting. So I think this is the success of big tobacco. Big companies, tobacco companies have been quite, sorry to say, but quite disingenuous and quite crafty in that, they have branded and marketed e-cigarettes and vaping as a trendy alternative to conventional tobacco smoking. And in doing that, they've enticed a whole new generation towards nicotine addiction. Trendy devices and flavors. And the reality is we now have evidence, Meera, that it is harmful to your lung health and your health in general. I think your listeners and viewers will be maybe familiar with this term EVALI, EVALI, which is e-cigarettes and vaping associated lung injury. And prior to the outbreak of the COVID-19 pandemic, remember there was a spate of cases in the US throughout 2019. I think as of February of this year, they've recorded almost 3,000 hospital admissions due to EVALI and over 70 deaths. And these were predominantly in what we would assume to be relatively healthy, youngish people. And what they found with e-cigarettes and vaping is you're heating up a solution to create an aerosol, to create a vapor that is then inhaled. And certain chemicals in the vaping or e-cigarette solution, in addition to nicotine, there's something called THC, tetrahydrocannabinol. And also there's an additive called vitamin E acetate. The vitamin E, if applied on the skin or if taken as a supplement orally, is fine. For some reason, if it's inhaled, then it seems to be toxic on the lungs. And the CDC and the FDA have identified these as some of the culprit agents. So we have evidence that just, even if we put COVID-19 aside, just vaping and e-cigarettes on its own is very toxic to the lungs. And in terms of COVID-19, there's just been a study published. I think we're both familiar with that in the Journal of Adolescent Health. Now this, if I can just briefly share with the listeners and the viewers. So this was a study that was published, just come out a couple of days ago in the Journal of Adolescent Health. And it's been published by researchers from Stanford University, which is a leading US Ivy League university. And what they did was they did an online survey looking at young people, aged 13 to 24 years of age, so adolescents, young adults, trying to study their smoking habits. And their findings were quite striking. they surveyed over 4,000 young people. And what they observed was that for young people who were smoking either e-cigarettes or vaping, they were almost 5 times as likely to be diagnosed with COVID-19 compared to their peers who didn't smoke at all. And for those adolescents and youngsters, these would have been college students and high school kids who were vaping and e-cigarettes in addition to tobacco, conventional tobacco, nicotine smoking, then they were 7 times more likely to test positive for COVID-19. So that's a long answer to the question that it would appear that this is all correlation and association. We have to be careful. We're not saying causation. But it would appear that vaping or e-cigarettes could be as if not more harmful than conventional smoking, and certainly would appear to be a risk factor, a potential risk factor for contracting and even spreading COVID-19.
And this is a younger group which ideally isn't susceptible to COVID-19, isn't it? They're not part of that risk group. It is the older people who are more at risk, people with comorbidities. And so if you do vape, and this is an adolescent study, as you said, then you're exposing yourself from 5 to 7 times more in contracting COVID-19. We have a question here. I don't smoke, but I'm often around people who do. Do I need to worry about secondhand smoke increasing my risk of getting COVID-19 or increasing the risk of severe complications if I do get COVID-19? That's a really good question, actually.
That's an excellent question. And I think the short answer is yes, we need to be worried. So, firstly, let's
really, even if you're exposed to secondhand smoke?
Absolutely. Meera, about 7,000 people die each year in the US from lung cancer who are non or never smokers, and I mean, smoking is the most identifiable and preventable risk factor for lung cancer. But for many of these so-called non or never smokers, it might be inadvertent exposure to secondhand or even third-hand smoke, passive smoking. I mean, in terms of COVID-19, which I think was the original question, we have to look at the mode of transmission. So now we understand better over the last few months globally and even here in Malaysia that the mode of transmission, it can be airborne transmission, it could be inhalation of respiratory droplets, it could be from aerosolization. So the particle, the virus attaches to smaller particles which are still drifting in the atmosphere or in the air, and then we inhale that. Now, if we take a scenario of someone who's smoking, and let's be honest, the vast majority of us, if we do contract coronavirus, COVID-19, we're going to be asymptomatic. Roughly 85% will either be minimally or symptomatic or asymptomatic. So you may not even know unless you're tested. So if we assume that a smoker is COVID positive, and he or she were to exhale and blow out the smoke, and it's in the vicinity of other people, theoretically there's every reason why there can be viral spread through aerosolization. So that is a real risk, and that's a real concern. So for me, I think in addition to the various SOPs that has been diligently put forth by our Ministry of Health and the WHO, fastidious hand washing, wearing a face mask, and social or physical distancing, I hope the authorities will be more, diligent in enforcing the smoking ban. For example, in the restaurants and eateries, we made a big step forward with that, but I think the enforcement is still a little bit soft, and that puts the non-smokers and children at risk in terms of all the risks of secondhand passive smoke, but also specifically here, potentially the risk of COVID-19.
It's interesting you said aerosolization, because that's the word that kept coming through when I read more about COVID-19 and smoking, right? Which brings me to the question of masks. If I'm standing with a person who's actually smoking or vaping for that matter, I am wearing a mask. Will that protect me from COVID-19 if this person indeed is positive?
Yeah. I mean, I think it's certainly it's essential. We even prior to the WHO recommending globally the use of face masks, even here with the Ministry of Health, there were studies from Hong Kong which demonstrated quite clearly that a person who is COVID positive, who has coronavirus, infectivity, the most infectious often a couple of days before you develop symptoms. That is when viral shedding occurs. That is the peak of infectivity. So, as I've said, the majority of us will be asymptomatic. And we know the mode of transmission, it could be, as you said, Meera, aerosolization or from just airborne transmission. So the use of a face mask, certainly in close confines, crowded spaces, public areas, definitely is helpful. The actual coronavirus particle, virus itself is tiny, but it will attach to respiratory droplets. You know, if you cough or sneeze or exhale deeply, and it's those particles that the virus attaches to that can be filtered out. So I think even a simple 3-ply mask or cloth mask is better than nothing. And of course, certainly for us in medicine, working in the hospitals, we would use an N95 mask if we're doing an aerosol generating procedure or more high-risk procedure. I think it's a very small sacrifice that we all should do to try and mitigate the spread of COVID-19.
Question, does shisha also put someone at higher risk of COVID-19 complications?
Short answer is we think yes. Again, we look at the habit of smoking, whether it's conventional tobacco smoking or shisha or e-cigarettes. You know, there's a lot of movement from hand to mouth, hand to face. Our hands are constantly, you know, in contact with high-touch surfaces, like, for example, a lift, a button, a door handle, the railings in a corridor. So in theory, if those are contaminated, then your hands get dirty and you can easily transfer the virus onto your face and mouth. Now with shisha, I think you often huddle together smoking in a group, and you share the mouthpiece, so that risk is definitely increased as well.
Okay, let's move on to lung cancer. How would you compare this burden of COVID-19 to the cumulative burden of lung cancer? And it's a big problem in Malaysia as well, am I correct?
Very much so, Meera. Yeah. I mean, I think COVID-19 is obviously global. I think we've clocked about 20 million cases in Malaysia. I think we're a little bit north of 9,000 cases and about 125 deaths. So as a country, we've done very well so far, but we can't afford to be complacent. But it's a highly infectious, communicable disease. And although it targets mainly our respiratory system, the airways and lungs, we now know that it can also affect any system in the organ. One of the things with SARS-CoV-2 coronavirus is it also affects the lining of the blood vessels. There's a propensity for clot formation, what we call as micro and macrovascular thrombosis, and therefore the need for anticoagulation and steroids. But it's an infectious disease, and hopefully with all the measures that are in place, and as we wait for that vaccine to come, if we can achieve, sufficient herd immunity either through naturally or more likely through mass vaccination, then this is something we may have to live with, the flu, but it's a communicable disease. Lung cancer is as you say, Meera, it's a major global health problem. In excess of 2 million people die each year from lung cancer. The commonality here is, I guess, in today's discussion is with smoking. In Malaysia as well, we still, it's the second commonest cancer in Malaysian men and fourth commonest in Malaysian women, but it's the leading cause of cancer death in Malaysian men. And in women, only breast cancer kills more. And the reason for that is, we're picking up the disease too late. In the early stages of the disease, often there are minimal or no symptoms, and we're catching it in stages 3 and 4 when the outcomes are not so good. But the big difference is this one is, it's been around for decades, centuries, lung cancer, and it's preventable to some extent in that you shouldn't smoke. That is the single most identifiable and preventable risk factor. Yes, there are other risk factors at play, but the challenge is to screen and diagnose and detect it early in at-risk groups. And it's not a infectious or communicable disease, unlike COVID-19.
So mortality is very high in Malaysia because of late diagnosis.
Absolutely, Meera. Mortality is extremely high. And as you know, we look at the outcomes for all cancers in terms of 5-year survival. And amongst all the cancers, with the exception of pancreatic cancer, but perhaps stage 1, lung cancer, worst performing. We're bottom of the league table, largely because, as you rightly said, late stage presentation. And the tragedy for us who are involved in the care of lung cancer patients in particular is that it is a curable disease if it's picked up early.
Okay, we have 10 minutes more. If you have a question, WhatsApp us 011-2571-2689. That number again, 011-2571-2689. We've got a question here. I have a relative who's cancer survivor, but is still smoking. Is his risk for COVID-19 higher considering these two factors, and is switching to e-cigarettes the lesser of all evils? Oh, I just can't wait for your answer for this one. Go, it's all yours, Anand.
I reckon that summarizes everything we've discussed. So, I mean, but it's a very, very pertinent and important question. I mean,
I think the lesser of two evils is what I really want to hear your answer to. But
sure.
let's tackle the cancer survivor who's still smoking and then now exposed to COVID-19.
Yes. Yeah. So I think the first thing to say there is, when we talk about the population as a whole, the so-called high-risk groups are obviously for COVID-19 the elderly. For obvious reasons, as we all get older, you're more likely to have comorbidities, less physiological reserve to withstand an illness or an ailment. But other groups at risk are certainly cancer patients, anyone who's immunocompromised. So a cancer patient, whether it's a lung cancer patient or any cancer patient, by virtue of their disease, if it's more advanced stage disease, or by virtue of the treatments they have, chemotherapy, radiotherapy, immunotherapy, targeted therapies, they will probably have a slightly compromised immune system, which means that they're more susceptible and have less ability to fight off an infection, a viral infection like COVID-19. And then, of course, this added whammy of someone who's still smoking. And I think the evidence is very strong that smokers, it's an independent risk factor. It increases the risk for more severe COVID-19 illness and a more adverse or worse outcome. So that's those are two not a good combination. In terms of who else is at risk, just to mention as well, I guess the other group would be frontline, healthcare workers and frontline. And if we look at some of the experience in the UK and the NHS, there was also an overrepresentation of the Black and Asian minority ethnics among the frontline healthcare workers, doctors and healthcare workers who succumbed to COVID-19. So that may suggest there may be a genetic predisposition, but it's difficult to tease out because it was also partly confounded by the fact that there was probably a higher incidence of hypertension and diabetes amongst these Asian minority and Black ethnic Black doctors and healthcare workers. But I think for that person's uncle who is a cancer survivor, who is still smoking, then their risk is pretty high.
Yeah. Is e-cigarettes the lesser of two evils?
I have to confess, up until now, that's the narrative that has been put forth, in the media and certainly by big tobacco, and that's what I would have also thought. But I think this study, if we look at the e-cigarette, EVALI, e-cigarettes and vaping associated lung injury, the deaths and hospitalizations in the US, and as you said, even in younger and seemingly healthier people, together with this recent study that we've just mentioned from Stanford, would suggest that it perhaps is not the lesser of two evils. It might actually increase the risk of spread of coronavirus.
Okay, we have a question. I see people wearing masks, but then when they're in the smoking corners, they huddle together and they puff into each other's faces. Is the risk of COVID-19 high enough that we should ban smoking in public spaces altogether? What are your thoughts?
I think you know the answer to that, Meera.
I know. You say it. I don't want to be the bad guy.
No, I know. Great. I think, the short answer is yes, we would love for that. I think one of the reasons why we think smokers are also at risk is if you are a chronic or active smoker, it's quite unlikely that you'll be able to wear the face mask effectively, donning the mask on and off. And I think we certainly wouldn't be, if I can just shamelessly briefly shout out that, I represent part of an NGO, Lung Cancer Network Malaysia. One of the things we advocate is smoking cessation, anti-tobacco legislation that is a very preventable thing. And I think the idea to create smoking shelters or smoking zones in public areas is a retrograde step. It goes against, it'll normalize smoking and it puts at risk the non-smokers. So yeah, I think that's definitely something that needs to be enforced. We shouldn't encourage it.
You know how you said lung cancer is always picked up late in this country, and so mortality is very high. But with COVID as well, there's so many people who are reluctant to go to the hospital in the first place. Did you see a rise of people coming in late because they didn't want to come to the hospital to get diagnosed?
Yes, you're right, Meera, we did. I think the MCO is so much needed and thus far has done its job, but people were genuinely afraid to come to hospital. And in April and early parts of May, it was pretty quiet in most of the hospitals in terms of elective planned surgery. And we were very worried for cancer patients, especially delays in treatment, delays in diagnosis. And then we started to see a considerable increase towards the end of May, June, and July. And you're right, there's definitely more. I don't have actual figures to substantiate this, but anecdotally, and talking to my colleagues, definitely more late stage presentation. Sometimes they're in a slightly worse shape. One of the things we do, just to share, Meera, is we do, I think it's a practice in all hospitals, private and public. If the patient is going to go for any definitive treatment or suddenly surgery, we would do a COVID test and test them, because we know data from China and globally, if you were to operate on someone who's COVID positive, then that substantially increases their risk of death and complications. So we would have to defer surgery, have them quarantined or treated, and then proceed with the treatment at a later time.
Okay. Oh, I love this comment on Facebook, and this has got to be coming from a smoker. Someone made this comment: "You might as well enjoy because you're going to die anyway." What are your thoughts?
Well, I mean, there's truth in that statement too. So, I often practice. I don't know if my mom's listening, but I often practice what she says, which is, too much of anything is no good, and most things in moderation is okay. Although I'm pretty relaxed as a doctor, but one thing I am strict about with my patients, heart patient or lung patients, is there's no good level for smoking. So I appreciate it's a very addictive habit and it's a very enjoyable habit, but there's absolutely no health and economic benefits with smoking. So I certainly can't sit here and say, can't
Sorry.
endorse that bit.
Okay. I think a lot of us didn't hear what we wanted to hear, but that's all right. What kind of support would you like to see for those trying to quit smoking during this pandemic, especially within the community? I mean, forget hospitals and pharmacies. There are too many barriers, with those institutions. But within the community, how do you think we can encourage more people to quit smoking, or think about it at least?
I mean, it's difficult. I guess I still feel the single most important factor is that the person must have a genuine desire and the will to want to kick the habit. And, sometimes it may take a loved one, their daughter, their partner, their girlfriend, their spouse, their mistress, someone to encourage them, nudge them in the right direction.
Can I ask, were you ever a smoker?
No, but I have to confess that when I was in medical school in Dublin, the odd time we would have all smoked some cigarettes, and that's a long time ago. But no.
Okay.
But I know it's a very addictive habit, and I know it's a very enjoyable habit, and it's difficult. But I think that will has to be there. There are various therapies available. We talk about nicotine replacement therapy in terms of the nicotine patches and inhalers and gums. I think we all know that, because it's the nicotine that's very addictive, Meera. And of course, sometimes you need cognitive behavioral therapy. There's no right strategy. Some might want to just quit cold turkey up front. Others might want to wean off, maybe set a date and work towards that. Sometimes you need someone meaningful in your life to nudge you along in the right direction to make that decision to quit smoking. Yeah.
Okay, and I know I fall back on the study from the UK. If 1 million people stopped smoking during the pandemic, or rather kicked the habit, 41% kick the habit because of the pandemic. I think we can do it as well. And I'm sure many of us are doing it already. We just don't do studies in Malaysia, do we? But if it's a motivation, why not? So you can download our guide on quitting smoking. We have tips for you to get motivated to kick the habit. Some of the questions we ask you there is, why are you quitting first? How to deal with nicotine withdrawals. And then we also have a My Quit diary if you want to help, guide you through the days. So would you have a message for us, Dr. Anand, on COVID-19 and smoking?
Well, Meera, I guess, it's still a fairly new disease. We're learning all the time, and certainly with smoking and COVID-19, the evidence is emerging and is growing to suggest that it's a fallacy and it's a fantasy to think that smoking is paradoxically protective. If anything, there's more, it's the contrary. There's emerging evidence that smoking is harmful, that it's certainly, if you are a smoker and you do contract coronavirus and get COVID-19, you are definitely at a higher risk for more severe illness and more adverse outcome. As to whether smoking will increase the spread of coronavirus, we don't have strong evidence, but the trend suggests, that it's quite likely. Certainly, if we look at that study we mentioned from the US, in the Journal of Adolescent Health. And so I think there's, this is a good enough reason to try and quit smoking as well.
Fantastic. So thank you for participating in this BFM Health and Living webinar series presented by AIA Malaysia. This is the 5th series in a series of 8 weekly webinars, and we'd like to thank our presenting sponsor, AIA Berhad, for making this possible. Please download the guide on quitting smoking. There will be a link in the comments below that you can click on. And one of you who downloads the guide will actually stand a chance to win a lucky draw prize, a MedClean Auto Plus worth 439 ringgit, courtesy of AIA Vitality. And the winner will be announced in next week's webinar on the 21st of August. And also, if you download the e-sharing kit, you'll be in the running to win a grand lucky draw prize at the end of the series, which is a Fitbit Charge 4 Special Edition Granite worth 838 ringgit, courtesy of AIA Vitality. Now, last week's winner for the lucky draw is Delina Kamarudin. Congratulations, Delina. The BFM events team will come in contact with you and arrange for your prize collection. In the next Health and Living webinar, we'll be talking about virtual medicine and whether it's safe to see a doctor during the pandemic, which is exactly what we're talking about, right? That fear of not wanting to go to a hospital. And Dr. Desi Baharaja, he's a Chief Medical Information Officer with Ainka Health, will be joining us. And that's happening next Friday at 12 p.m. Visit bfm.my/health event to find out more. Our feedback form is posted in the comment section below. Yes, I know you can tell them about how I bungled up the beginning of this webinar with technical issues, but that's all right. We've only got 5 questions. Fill it up and tell us what you thought of this session. Thank you for joining us. Dr. Anand Sachithanandan, consultant cardiothoracic surgeon and president of the Lung Cancer Network Malaysia, speaking to us about what COVID-19 has taught us about smoking. Thank you for joining us. Have a good weekend.